Welcome back to Understanding Human Anatomy. This video will discuss the ribs and sternum, and thus completing our discussion of the axial anatomy with the exception of the skull. So we'll start by talking about the rib. We'll start by drawing the head of the rib. And a narrow part just distal to the head is the neck of the rib. Then we'll draw the tubercle of the rib. And as it gets out to the edge of the back, the rib changes direction. That is the angle of the rib. And it wraps around the thorax to end in the distal portion of the rib. Now I'm just going to draw the other side of the rib here. So if we put some diagrams, some labels on the diagram, we have the head of the rib, the head of the rib, the narrow portion just distal to the head, the neck of the rib. I'll draw a connecting line just so we know exactly where the neck is. And we have the tubercle, and again we'll draw a line to the tubercle. Where the rib changes direction is known as the angle. And this is not as precisely defined, it's just where the rib changes direction. So we'll indicate it being right about this position. And then the distal end of the rib and onto the distal end is some hyaline cartilage. And that cartilage is called costal cartilage. And it can be of various lengths depending on which rib we're talking about. So that the blue here is the costal cartilage. The costal cartilage, for most ribs, will attach the distal end of the rib to the sternum. The proximal end of the rib attaches to the thoracic vertebra in two places. The head of the rib attaches to the demifacets on the body of the vertebra. And actually what it does, it connects to two vertebrae. It comes in between the bodies of the vertebra and attaches to a demifacet on one vertebra and a demifacet on the other vertebra. Then the tubercle of the rib attaches to the facet on the transverse process. So the head connects to the demifacets on two vertebral bodies. The tubercle attaches to the facet on the transverse process. One needs to remember that as the rib wraps around the thorax, the end of the rib moves further inferiorly, further lower down, so that the distal end of the rib lies inferior to the proximal end. So the ribs do not wrap straight around the body. As they wrap around, they descend as well, so that a rib such as the fourth rib will attach to the fourth thoracic vertebra, but its distal end will be down around the sixth thoracic vertebra level. In all, there are 12 pair of ribs in the thorax. That's one rib or one pair of ribs for each thoracic vertebra. Recall that the characteristic of thoracic vertebra is the articular surfaces for the ribs. Ribs 1 through 7, the first 7 pair, are called true ribs. Let's put that in quotations. And they're called true ribs because their costal cartilage attaches directly to the sternum. So true ribs, the costal cartilage that attaches to the distal end of the rib, connects that rib to the sternum directly. Now, if there are 7 pairs of true ribs, that means there are 5 pairs of false ribs. And those are ribs 8 to 12. Now, with the false ribs, ribs 8 through 10, their costal cartilage attaches to the 7th rib's costal cartilage. So these ribs don't attach directly to the sternum, but they do attach indirectly. However, for ribs 11 and 12, their costal cartilage does not connect to anything. The distal end of the rib does not connect to any other bony structure. So these ribs are known as floating ribs. Their distal end is not attached to any other bony structure. The sternum is casually known as the breastbone. It consists of 3 parts, and it's formed from 5 segments called sternebrae plus some extra cartilage. So let's start by sketching in what the sternum looks like. We'll start at the most superior part of the sternum. And this is a part of the sternum called the manubrium. Which looks like this. Right? The manubrium joins the body of the sternum at a location known as the sternal angle. And then the most inferior tip of the sternum is a piece of cartilage known as the xiphoid cartilage. So let me put some labels onto this. We'll start with the manubrium. Manubrium. The body. And then the xiphoid process. Now, the xiphoid process is cartilaginous in young individuals, but with age it becomes ossified into bone. There are some structures that we need to look at. One I've already mentioned, and that is the sternal angle. And the sternal angle marks where the costal cartilage of the second rib attaches, but its vertebral level is the fourth thoracic vertebra. In other words, the second rib attaches there, but if we were to push a knife directly through the sternal angle back to the vertebra, we would run into vertebra T4, the fourth thoracic vertebra. Remember that vertebra descend, move inferiorly as they wrap around the thorax. So at the distal end of the vertebra is lower than the proximal end. So while the second rib is attached to the second thoracic vertebra, its distal end is at the level of the fourth thoracic vertebra. And we'll learn that this level T4 is an area that's very important. There's lots of things that happen at T4. It's a very useful landmark when we look at the thorax. There is a notch in the manubrium called the sternal notch, and it's just a depression that you can palpate. If you feel on yourself, on your breastbone, up at the top, you can feel a slight depression there. That is the sternal notch. So, in summary, there are 12 pairs of ribs. The head of the rib articulates with two demifacets on two different vertebral bodies. The tubercle of the rib articulates with the facet on the transverse process of the thoracic vertebra. The distal end of the rib is attached to a costal cartilage, which in most cases attaches to the sternum either directly or indirectly, but in two ribs does not attach to any other structure. The first 7 pairs of ribs, 1 through 7, are called true ribs because they attach via their costal cartilage directly to the sternum. The remaining 5 pairs of ribs, are known as false ribs, but of these, ribs 8 through 10 attach indirectly to the sternum by having their costal cartilage attached to the 7th rib's costal cartilage. The 11th and 12th rib have costal cartilages that are very short and do not attach to anything, so that these ribs are said to be floating. So, 12 pairs of ribs, 7 pair are true, 5 pair are false, and of the false ribs, the last 2 are floating. The sternum consists of manubrium, body, and xiphoid process. The sternal angle is formed where the body and the manubrium meet. The sternal angle is where the second rib articulates or attaches, but it is at the vertebral level of T4. That concludes our discussion of the ribs and sternum. Thank you for your attention.